Hi there, my name's Kat and I'm a clinical nurse specialist here at IHTC. This presentation is for patients that are preparing for or interested in receiving HEMGENIX gene therapy. Let's start out by talking about what is HEMGENIX gene therapy and how does it work? Well, HEMGENIX was approved for the treatment of hemophilia B, also known as factor IX deficiency, by the FDA in November 2022. It was the first hemophilia gene therapy treatment to be approved in the US. To take HEMGENIX, you must have hemophilia B and meet one of these conditions. Either you use factor IX prophylaxis therapy or preventive therapy, which means you use regular factor IX infusions, and or you must have had life-threatening bleeding now or in the past, and or you must have had repeated serious bleeding episodes with no known cause. Many people that have been treated with HEMGENIX in clinical trials have fewer bleeding events and are off of their regular factor infusions, but of course the results may be different between patients. There are other gene therapy treatments for hemophilia, but they are still in review at this time. I'm going to show you a brief video that will give you a quick overview to how gene therapy works for hemophilia.
The most common treatments administer clotting factor replacement therapy. Gene therapy could offer a one-time treatment. With gene need to be delivered into the cells using a vector. Trials are currently being conducted in eligible adults with hemophilia. This helps to avoid the beneficial effects. The most common
I hope that visual demonstration of how hemophilia gene therapy technology was helpful. So as far as how HEMGENIX is given, it's given as a one-time infusion, typically at an HTC or hemophilia treatment center or a facility that is knowledgeable in treating hemophilia patients. It's infused into a vein with a needle like a factor product, but instead of directly out of the vial, the infusion is given typically with an IV pump. The infusion will take at least a few hours, and a patient must be watched at the clinic for a few hours after the infusion for safety purposes. So what is the target body tissue for this gene therapy? Well, in hemophilia B, as you may know, your liver does not make enough factor, in this case factor IX, So HEMGENIX targets cells in the liver, which will help ensure that the factor IX made by your body after the gene therapy treatment will work properly. Here's another quick video that will give you a visual demonstration of how the gene transfer works.
You may be how a gene and the genetic material it holds is transferred. How a gene
So now that we've seen a visual of the gene transfer, let's talk more about how that works. So in the case of HEMGENIX, the gene that's used is packaged inside something called a vector. You can think of a vector as like a suitcase or a package that's going to carry the gene to its destination. From there, the vector can then enter certain cells in your body. In this case, it will be cells in the liver, and deliver the gene to those cells. Hemophilia gene therapy at this time uses a modified virus as its vector. In the case of HEMGENIX, it's adeno-associated virus 5. This is a virus, however, it's not dangerous to humans, meaning it does not cause illness or any harm when it infects you. So vectors are used in all kinds of gene therapies, and they can contain any kind of different gene depending on the disorder that's being treated. In the case of HEMGENIX, since we're treating factor IX deficiency, the AAV5 vector that they use contains a working factor IX gene that the patient is missing. So this gene then effectively teaches your liver cells how to make factor IX. You can see a nice illustration of that here at the bottom. The vector has been engineered to contain the gene, the working factor IX gene. The patient receives the infusion, which contains the AAV vectors, and from there the vectors then target the liver cells and deliver that working gene to them. So at this stage, you may or may not know that we will need to do blood work to check and see if you have AAV5 and how strong your body's response to that virus is before you can get HEMGENIX. Well, why do we need to test you for this first? When you're exposed to any virus, whether it's AAV5 or the flu or other viruses or even to vaccines, your body has an immune response, and part of that is it forms proteins that are called antibodies that are specific to the virus in question. Antibodies essentially help your body remember a virus that it's had before, and helps you protect yourself from a future infection, or it can make future infections less severe than the first one. So that's why sometimes you might get sick again with something, but maybe it's not as bad as the first time. We can test to see if a person has antibodies to a virus by checking their blood. Again, you can get this from getting infected with a virus and being exposed to it, or you can get it from vaccines as well, which is how they protect us from infections. Here's a really nice visual illustration of how antibodies work.
The immune system attacks germs and helps
So now that we know a little bit about what antibodies are, why do we need to test you for them for AAV5 before you get HEMGENIX? Well, actually, AAV5 is, again, a harmless virus, but it's fairly common. About a fourth of people in the United States have been exposed to it and have antibodies to it. And part of the reason we test you for it is because if your body has been exposed to AAV5 and you have too many antibodies to it, then your immune system is going to try to help protect you from it, essentially. And that can make it so that the gene therapy product doesn't work. Because HEMGENIX needs to use that virus in order to target your cells and deliver the gene to them, if your immune system fights off all the AAV5 viruses that you're exposed to, then essentially it won't work. So we need to check your blood and first of all, see if you have AAV5, and then if you do, see how strong your immune response is. If you've been exposed to it, doesn't mean you can't receive HEMGENIX, but we just need to make sure your immune response is not going to be too strong to make the product not work. So now that we know how AAV5 delivers the gene, where exactly does that new gene stay in the target tissue? So again, the target tissue are liver cells. The new gene, again, contains instructions that will basically teach your liver cells how to make factor IX. Right now, the gene therapy that exists for hemophilia, it delivers a healthy copy of the gene, but it doesn't insert it into your DNA, so it's not editing your own genes. That also means that because of this, you will still have the genetic mutation for hemophilia. So if you go on to have children after this, the gene will still be passed on to your daughters, and your genetic mutation does not go away. So how long does the new gene last? It's a big question. The answer is we don't always know. So some gene therapies might be long-term or lifelong, and others might only last for a few years. It's different for each patient. Everyone has different results, and of course it's also different for each kind of gene therapy. Unfortunately, we cannot predict how long your results will last if you get this treatment, but we can show you what other patients have experienced from clinical trials and prior experience. And we can also tell you that the follow-up period right after your infusion, in the first year especially, is very important because during that time, we're going to be checking blood work, we're going to be doing other checks on you, and possibly give you medications that will help increase the chances of the gene therapy treatment working for you. It's also important to know there is no guarantee, and there's a chance that gene therapy might not work for you. So we do have some research data on HEMGENIX at this time. There have been 3 HEMGENIX studies that date back to 2015, and since that time, researchers have not found any new safety concerns after those years of follow-up. So effectively what we know now has been the same since we started these studies. So the first study looked at only 10 patients, and they were only getting a low dose. This was an early study where they were just looking to see, is it safe for humans to receive this treatment? So again, these patients received a low dose. The patients that received it, all 10, have remained stable factor IX activity levels in all the patients 5 years after dosing. The second study looked at 3 patients that took HEMGENIX 3 years ago, and their average factor IX levels are now up to almost 37% average, which effectively took them to having a very mild case of hemophilia B. The third study in question has the most patients. It looked at 54 patients that took HEMGENIX 2 years ago, and their average overall patient factor IX levels are now right about 37% as well. 2 of the 54 patients did not respond to the treatment, so there were a couple reasons why we think this happened. One patient did not actually receive the full infusion, so they only had a partial dose because the infusion was stopped early, so that's why they did not have a response. The other patient had a very high level of AAV5 immunity. So that means when we checked their blood levels for AAV5 antibodies, we saw that they had a very high level of immunity. So there's a really strong chance that that high level of AAV5 immunity, all these antibodies, neutralized the HEMGENIX and made it so that it does not work. So that's why we want to check to see how high your immunity level is to make sure that the product's going to work for you. So having just talked about the research data for HEMGENIX and the factor IX levels, this is a visual of that. So there is a lot to look at on this slide. You can start by looking at the red line there, which is the larger study that had the 54 patients who received the full dose. Now, I mentioned that only 52 of those patients had a response to HEMGENIX. So one patient didn't receive a full dose, and another patient had an immune response that didn't let the HEMGENIX work. So this is looking at really those 52 patients that had a response and averaging their factor IX levels as a whole, meaning all 52 patients, to see what their average level is. So this shows you at the bottom of the chart, you can see months after infusion. So there's a tick mark that says 6 months, and then 12 months, 18 months, and 24 months. So that means there's 2 years of data in this chart showing you how those 54 patients, how their levels were averaging over time. So they've stayed fairly stable, starting at an average of 39 6 months post-infusion to ending at 37% average 24 months or 2 years post-infusion. So that means these patients have stayed around higher 30s average overall after receiving HEMGENIX for those first 2 years. The other line that is gray is only 3 patients, but it's also patients that received a full dose of HEMGENIX and had a response. So the average for those 3 patients is even higher than the other batch of patients. So those 2 lines are going to give you an idea of what the average of all those patients were that received HEMGENIX and had a response. So that should give at least an idea of what kind of response you might have if HEMGENIX works for you. The other 2 lines that are much lower on the chart are lines that represent the patients who were in the lower dose safety studies. So those are patients who didn't receive a full dose because they were just checking to see if HEMGENIX was safe in humans. So as you can see, their response, meaning their factor level, is much lower because they didn't receive a full dose. However, you can still see that they went from a low level to a higher level, and they have stayed consistent over a long period of time. So another piece of information that we can look at when we're looking to see how well a treatment works for patients is called the annual bleed rate, or sometimes called the ABR in hemophilia circles. And that just means what is the average number of bleeding events that a patient has in 1 year. So of those 52 patients I mentioned that received that full dose of HEMGENIX and responded in the final study, before they had HEMGENIX, their average ABR was 4 bleeds. So that means they had an average of at least 4 bleeds per year. Now, after the first year of HEMGENIX, meaning 1 year after receiving HEMGENIX, the overall average for those 52 patients was an ABR of only 1.1 bleeds. And then 2 years after, they had an average ABR of 0.95, or right about 1 bleed. So you can see overall that patients went from having about 4 bleeds per year to only about 1 bleed per year on average. So with any new treatment, there's always risks and benefits that you have to weigh. So let's talk some about what the possible benefits and risks are of HEMGENIX. Well, one of the major possible benefits of taking HEMGENIX is, like we just saw in previous slides, your factor IX levels might increase based on what we've seen in other patients in research studies. Because of your factor levels going up, you may need fewer or even no regular factor infusions because you will possibly have fewer bleeding symptoms. And overall, we can assume that this might result in better quality of life for you because you're not having as many bleeds, you're not having as many infusions for treatment, and you're not having to possibly do your regular factor infusions or your prophylaxis. So it would just result in a much easier life for you. So again, when looking at the possible benefits of HEMGENIX, we can look back at the data that I showed before on prior slides of the factor IX levels before and after taking HEMGENIX. So in that study with the 54 patients who took HEMGENIX, prior to taking it, their factor IX levels on average were 5% or lower. Then at the 1-year mark after taking HEMGENIX, the patients had an average factor IX level of right about 41.5%. And then 2 years after HEMGENIX, the patient's overall average factor IX level was 36.7 or almost 37%. So you can see that's a big change from their baseline of less than 5%, and it stayed consistent after 2 years. Now, of course, even with those benefits in mind, we have to remember that every kind of treatment has possible side effects. So we know about some of the side effects of HEMGENIX, and the most common ones are infusion reactions. So that means they happen during the infusion when the patient was actually getting the IV infusion of HEMGENIX or right after. So these are similar to an allergic reaction, and they tend to only last a short time. And luckily, we can manage these during an infusion with medications like Benadryl, which is an antihistamine, or with something called corticosteroids, or just short for short steroids. So a lot of the common ones that have been seen during these HEMGENIX infusions are things like facial flushing, maybe feeling cold and getting chills and shivering, a rise in blood pressure, stomach pain, tight feeling in the throat, itchiness, headache, feeling dizzy, or tight feeling in the chest. And again, with all of the patients we've seen that have had HEMGENIX infusions, these were short lasting and they resolved after the infusion. There are some more serious side effects possibly from taking HEMGENIX though. One of the more common possible serious side effect is liver inflammation. So inflammation effectively just means when your cells or your tissues become swollen and irritated. So since HEMGENIX targets the cells in your liver, it can cause liver inflammation where the liver tissue becomes swollen and irritated. This is actually something we kind of expect because of the way your immune system responds to the treatment. So sometimes when people have inflammation, we can prescribe them something called a corticosteroid, which you may have heard of, also just called steroids sometimes. A common one that is used is called prednisone, and steroids can help reverse inflammation in the body by helping reduce the response that your immune system has. So basically just kind of help calm that immune response down and let the tissues, let the inflammation go down in the tissues. So in the clinical trials, liver function blood work, meaning that when we did blood work to check the patient's liver function, it got worse for about half of the patients, 24 out of 54, 44% of the people. 9 out of 54, 17% of those patients did need treatment with steroids as a result of the inflammation. And of those 9 patients, on average, they needed the steroid treatment for 80 days. That means that they had to take that medication every day for 80 days until their inflammation was better on average. Another possible serious side effect, of course, is that it might not work for you. So you might receive this treatment and your factor IX levels may not improve, or maybe they improve and then they go back down again. Unfortunately, another thing to keep in mind is that if HEMGENIX does not work for you the first time, you are not able to take it again because your immune system is going to remember the vector and it's going to neutralize it or reject it if you receive it again. So going back to what we talked about with antibodies, your body will remember the virus. So if you try to get it again, it's very likely that it won't work at all. Another possibility is that you may not be able to take any other gene therapy products in the future. At this time, we don't have any hemophilia gene therapy treatment products that you can take more than once. Now that might change in the future, but it's important to keep in mind that once you choose to do this treatment, you may not have a chance to do it again or do any other gene therapy again. So it's something you need to keep in mind. Another possible serious side effect is an increased risk of cancer because of the way that gene therapy affects cells. We think this risk is very low, but of course, we don't know. It is a possible risk. Of course, HEMGENIX is a new treatment, so there could be other benefits or risks that we just simply don't know about yet at this time. Of course, if we do learn new information, especially safety information, we will contact you right away and let you know. So now that we know some about how HEMGENIX works, let's talk about what is expected of a patient if they take HEMGENIX. So of course, the first thing is we'll need to do an in-depth screening to make sure that you are safe to receive HEMGENIX. So at this point, you may have already had, or you will soon have, conversations with your doctor about HEMGENIX. You'll receive blood work, which will include the AAV5 test that we mentioned before, and also some other baseline blood work to make sure you're healthy and able to receive the product. We'll also do a mental health and psychosocial assessment to make sure that you're ready for all the things that are expected of you, both during your infusion and in the follow-up period after, and see if there's anything we can do to help increase your chances of success. And then, of course, we'll have to make sure that your liver and your heart are healthy enough. This could include blood work, taking a look at your medical history, and possibly doing scans of your heart or your liver if there's any concerns. So beyond the screening process, what's expected of you as a gene therapy patient? There's actually quite a few expectations and commitments that we need from these patients. So as you can see, this is just a quick at a glance, and I'll talk more about each of these in more depth on the next slides. But it's anything from not drinking alcohol and using sexual precautions for a period of time after your infusion. It's also during the follow-up period, doing your follow-up blood draws, taking your steroid medications if you need them. A big part of it is also communicating with IHTC staff so that we know everything that's going on with your health during this time. And another thing to know is that you will not be able to donate blood or tissues after your infusion. So this slide shows you a little more detail about how long each of these expectations will last, and I will talk more about each of these in depth on the slides to come. But the first one, as you can see, is to use a condom during sexual activity, and that we will need patients to do for at least 6 months after their infusion. The second listed is not drinking alcohol, and that will be required for at least 1 year after your infusion. Because of regulations and the safety, basically the unknowns that we can't predict, we can't let patients donate blood, organs, tissues, transplant cells, anything of that nature ever again after their gene therapy infusion, at least at this time. We will also need you to follow your steroid treatment plan if needed every day for weeks to possibly months, depending on how long you need to take those steroids. So alcohol, why can we not drink alcohol after this infusion? Well, we learned earlier in this presentation that HEMGENIX and hemophilia gene therapy targets the liver cells. You may know that alcohol is very hard on the liver, and it can actually cause or even worsen inflammation in the liver. So if you are drinking alcohol after you receive a hemophilia gene therapy product, you're really increasing the chances that the gene therapy could not work or stop working. You're also putting yourself at risk because it's very hard on your liver, which is a vital organ. So after your gene therapy infusion, you must not drink alcohol for at least 1 year. This is to not only increase your chance that it will work, but also to protect you and keep you safe. After 1 year, even after a year after your infusion, we recommend that you still resume only light drinking, if at all. So we recommend that you would drink no more than 3 drinks total in 1 week, and that also means no more than 1 drink on any given day. So let's talk about the sexual precautions. So why do we ask patients to use a condom for the 6 months after you've had your infusion? Well, we know from the research studies that have been done that that viral vector, the AAV5 virus that was used to treat you in the HEMGENIX, can stay in your body fluids for some time after the infusion. So that means things like your blood, your saliva, your urine, your semen, etc can still contain that viral vector for a period of time after. In the case of semen, we know that it stayed in patients' semen for up to 6 months after their infusion. So this is why we ask you to use a condom for at least those first 6 months. There's 2 reasons for this. We of course want to prevent pregnancy to protect any possible offspring you have, but we also want to protect your partner. So even if you have a partner that can't get pregnant, we still want you to use condoms to protect them from being exposed to that vector in your semen. So that's why it's really important. If you do have sex with a partner who can get pregnant during this time, we recommend to further prevent pregnancy that they consider using a second form of birth control as well, like the pill or an IUD. So another safety expectation after gene therapy is that you can no longer donate any blood, organs, tissues, or cells, anything of that nature for the rest of your life. And that is a guideline in place at this time simply because there are too many unknowns and we need to protect the recipients of those donations. It could change in the future, but at this time, the expectation is that you can no longer donate for the rest of your life. Another important thing to know is that after gene therapy, you do still have the genetic mutation that causes hemophilia, and you will still pass it on to any daughters that you may have after treatment. Another important expectation we have of patients who do gene therapy is we want you to take care of yourself. We want you to try to stay well, do things that are going to keep your body and your liver healthy, because this is going to increase the chance that the gene therapy will work for you. So that includes things like trying to eat a healthy diet, trying to stay physically active, avoiding alcohol, and just following overall health and wellness guidelines that will keep you healthy. So now that we have talked some about the safety expectations, let's talk a little more about what kind of follow-up is going to be needed after your infusion. So in those first 2 weeks after your infusion, we'll want to keep a close eye on you. So we'd like to do a physical exam and some blood work at least once per week in those first 2 weeks. Once you hit week 3, from 3 weeks to 3 months after your infusion, we'd like to do blood work at least once per week. That is a lot of blood work, and I'll talk more about why it's so important on the next slide. When you hit months 4 through month 12, we'll want to do blood work at least once per month. Now, of course, all of this could be more if you're having problems, and we'll talk about why that is. Once you hit 1 year after your infusion, we'd like to see you for a physical exam and blood work at least twice a year. And that's pretty typical of what we would want with any of our hemophilia patients anyway. So again, with all those blood draws, why are we doing so much blood work in that first year after your infusion? Well, it's for a very good reason. So the 2 main things that we're looking at when we do that blood work is we're checking your liver health. So we're looking at certain enzymes that your liver releases to see if your liver is doing okay or if it's having inflammation. We're also looking at your factor IX level to see how it's doing. Is it staying stable? Is it going down? If your factor IX level is suddenly going down, then we want to know if there's a reason for that, if we can do something to help prevent it from going down anymore. So again, these blood draws are going to be at least weekly for the first 3 months. They could be more often than that if you need more monitoring. So if you're having liver inflammation and we're having to treat you with steroids, there's a chance that we could need to do more frequent blood tests. After your first 3 months, we hope that you can go down to at least monthly blood draws. Of course, at that point, if you're still having issues with liver inflammation, then they could be more frequent than that. And as always, as an IHTC patient, it's very important for you to communicate with us, especially after you have gene therapy. So this is not only for your safety, but this is also to help increase the chances that the gene therapy treatment is actually going to work for you, because the way that you're managed after your infusion can really make or break your success. So in order for us to do this, we're going to need to know everything that's going on with your health, both before your infusion and in the follow-up period. So if you have any changes in your health, even if it's a new symptom or something as simple as you started a new medication or a supplement, please tell us right away, because that could change the way that we choose to manage you. If you think you're going to have trouble getting to one of your follow-up blood draw appointments, please tell us right away so that we can try to make a plan for that. And also, if you're not able to follow one of the expectations, such as you drink alcohol or you fail to use a condom during sex, please tell us right away. And again, this is not because we want to scold you or make you feel bad about it. It's just really important for us to know, because it's going to affect your safety and your outcomes. So, for example, if you use alcohol, this could put a burden on your liver, and it could change the way that maybe we choose to dose your steroids. As far as the safe sex, we want to protect your partner. So if we think that maybe they're at risk of having been exposed to the vector or at risk of getting pregnant, then we can do some extra safety monitoring for your partner as well. So again, these things are really important for us to know, just because it's going to change the way that we potentially manage you as our patient. Another important patient commitment after your gene therapy infusion is going to be following your steroid treatment plan if you need them. So after your infusion, if your liver health worsens or your factor IX levels go down, there's a good chance that that's happening because there's inflammation in your liver. So we can prescribe something called corticosteroids, which are also just called steroids for a period of time. A common one that you may have heard of is called prednisone, which is the kind that we will prescribe you in this case. So taking prednisone can help lower the inflammation in your liver, which will increase the chance that the HEMGENIX is going to continue working in those liver cells. So if you do need steroids for this treatment, you will need to take them every day until we can tell you to stop, or until the liver inflammation gets better. So it can be quite a bit of time. It could be weeks to possibly months. In that HEMGENIX study with the 54 patients, 9 of them, or 17% of those patients, did need steroid treatment, and the average amount of time that they needed them was 80 days. There's some important things to know about taking steroids. So with a steroid treatment plan, you need to take them at the same time every day as much as possible. It's also important to know that you will start at a certain dose, and then your dose will get smaller and smaller over time until you finish your treatment plan. You need to follow the treatment plan that we give you as closely as possible, and do not skip doses, change the schedule, or just stop taking them all of a sudden. You need to taper off of this medication slowly, and we'll give you thorough instructions on how to do that. Another important thing to know about taking steroids is there are a lot of possible side effects when taking these medications, and they're not fun. It can be really unpleasant to be on steroids for a period of time, so it's something that you should plan and kind of just anticipate that you might have to go through this after your infusion. There are patients that really struggle with some of these side effects. Even if you're having these, though, it's very important that you do not stop taking your medication all of a sudden. We need you to continue taking it and follow the treatment plan as prescribed. So if you're taking steroids and you're having some of these symptoms and you're really having a hard time, we ask that you reach out to us right away and talk to us about what's going on, and we can try to help you get through it, whether we can help mitigate some of the symptoms or come up with a different plan for you. All that being said, because of the way steroids work in your body, you may need extra monitoring during your steroid treatment if you have one of these conditions. So if you have diabetes or pre-diabetes, if you have blood pressure problems, glaucoma, or you have a history of mental health or mood disorders, we want to know about that before you get treatment so that we can anticipate that if you do need steroid treatment, we can do extra monitoring and make sure you're safe and you're comfortable. And last but not least, another commitment we ask of our patients after gene therapy is a commitment to contribute to public health. So hemophilia gene therapy is brand new, and in order to learn about how it works for everyone, we're going to need to collect data and help us understand how it will work for others. So at IHTC, we have several public health studies about patients with hemophilia that we can enroll you in. And at the time when you do your screening process, we will talk to you about these studies and see if you want to enroll in them at this time. If you do enroll, then the information that we collect about your gene therapy treatment can be used for the greater good and basically help us understand more about how it's going to work for other patients with hemophilia throughout the world. It's important to note too that your data is always collected anonymously, so your name and none of your personal information is attached to it. So having reviewed all of that, you can see that gene therapy is a really big commitment. Yes, it is just one infusion, but there's so much after that infusion. There's a lot of follow-up care. There's a lot of safety expectations and things that we ask of you as the patient. So it's really important at this time to consider if this is the right treatment for you. And I would say if you feel that you can't commit to any of these things, you should really reconsider if this is something you should pursue. So for example, if you find that some of the safety expectations are too much for you, like not drinking alcohol for a year or using a condom for at least 6 months, if you feel that the schedule for all those follow-up blood draws and visits is too much, or if you look at that list of side effects for steroids and you feel that taking steroids for weeks to possibly months is going to be too much for you. These are all really good reasons to pause and really think about this before you commit to doing gene therapy. So now is a really good time to take a step back and ask yourself, are you ready for gene therapy? Is this the right treatment for you? Now, of course, no one can answer that question for you, but it's important to make sure you talk to your doctor at IHTC about this decision. If there's a nurse or another trusted staff member at IHTC that you want to talk to about this, and definitely talk to your family and your friends and the people you trust in your life about this decision because it's a really big commitment. Some other things you'll want to talk about and think about during this time are, do you really understand how gene therapy works and do you understand the possible risks? What is your personal goal for taking gene therapy and does that goal line up with the information you've learned? So again, it's not just a magic solution like a one and done infusion and then you don't have hemophilia anymore. It's a commitment and it's not a surefire cure. So you need to keep that in mind. And finally, can you stick to the follow-up requirements and the safety expectations that we have of you as the patient? If you don't think you can, then it really is important to reconsider if this is the right treatment for you. So again, keep this in mind. The journey of 1,000 miles begins with a single step. So today you might be taking that first step on a long journey. If you feel that you are ready, talk to your physician about it, and we can take the next steps and get you screened for HEMGENIX. Finally, this was a lot of information to take in one presentation. At IHTC, we want to make sure we do the best job we can at helping our patients be prepared before they take a new treatment. So we want to make sure we've done our part to teach you and help you understand everything. That includes how the product works, what the possible benefits and possible risks are that we know of, and what's expected of you as the patient. So now, before we get you screened for HEMGENIX, we want to do a quick questionnaire that's just going to check your understanding of the information that we've talked about. That questionnaire is not going to be a pass-fail that will tell us whether you can or can't take HEMGENIX, but it's going to help us see if there's any area that maybe you didn't understand very well that we can go back and revisit and maybe help you learn more about and make sure you understand before you proceed. So we can do that either on paper today, or we can give you a tablet to complete in the clinic. And finally, if you're looking for more information about either any gene therapy or hemophilia gene therapy in particular, here are some really good resources, videos and websites and organizations that we recommend you use to learn more. These are the references that we use to provide the information in the presentation for you. And here's our contact information as always as well. So I hope this presentation has been helpful. And again, if you want to learn more about HEMGENIX, please reach out to us or talk to your physician at IHGC. Thank you so much.